Please remember at this time, you should avoid putting your face near to the mouth and nose of a casualty. This video will demonstrate the first aid for an injury to a casualty's bone, known as a fracture, or their muscle and/or joints, known as a sprain or strain. Let's start by looking at what to do if you suspect a casualty has a broken bone, fracture. Help the casualty by supporting the injured area, making sure the injury is kept still so that it doesn't become worse. Protect the injury with padding and try to move as little as possible. The injury will be very painful, and if the bone is broken, it could be unstable, so make sure the casualty keeps still. Use a sling or bandage to support the injury if the casualty allows you to do so. Always talk to the casualty and let them know what you're about to do. Check if it's okay with them for you to carry out any help before doing so. Now it's time to call 999 or 112 if you need emergency help. However, if the casualty is not in shock, then an injury like a broken arm can easily be taken to hospital in a car. You don't always need to call for an ambulance, but leg injuries should always be taken in an ambulance. Remember that a fracture can result in shock, so be ready to treat for shock if needed. Continually monitor the casualty until the ambulance arrives. Stay with them, offer plenty of reassurance, and keep them calm. If you suspect the casualty has a sprain or strain, help the casualty to sit down and support the injured limb. Raise the limb if you can, as this will help with any swelling. Cool the affected area with a cold compress, such as an ice pack or something similar like a bag of frozen peas. This will again help to reduce swelling at the site of the injury. Apply comfortable support to the injured area. You can use any item suitable to provide padding and support to the injury. Minimize movement of the injured area to prevent pain and further injury. Use a sling or bandage to support the injury in a raised position if the casualty allows you to do so. Elevating the injury in this way will once again help to minimize swelling. Reassure the casualty throughout each stage of treatment and keep them calm. If severe pain persists, you should send the casualty to hospital. Remember, your casualty's condition could possibly get worse, and they could even become unresponsive. If this happens, then be prepared to use basic life support and start CPR.